Hi, everyone. I'm Lisa Delpi-Narati, Professor of Sports Management at George Washington University, and I'm pleased to be the moderator for the Health and Safety panel today. We have some excellent guest speakers with us, of Jeff Oxendine with Health Workforce Development, Megan Mendoza with NFL. Is David on? David will be joining us. And Gregory Charlop with Retired Athlete Health. So thank you for being with us. And I always like to just start off by asking each of you to share a little bit about yourself and your work in the nonprofit space. So we'd start with you, Megan.
Yes, thanks, Lisa. Hi, everybody. I'm Megan. I work with the NFL in community relations. I'm a manager. Specifically, as it relates to this panel, I work predominantly on NFL Play 60, our youth health and wellness initiative to get kids moving for 60 minutes a day. We're in our 15th year and looking forward to discussing more with this group. Thanks for having me.
Thank you. Jeff?
Hello, everyone. I'm Jeff Oxendine. I'm the founder and CEO of Health Career Connection. And what we do is we provide promising undergraduate students or recent graduates who are from backgrounds that are underrepresented in the health field with opportunities to become the next generation of health leaders and professionals. We do this by providing paid opportunities for folks to get hands-on exposure, experience, mentorship, and networking, so they can choose which health career best suits them, and they can go on to become people who transform health in our communities. People's health is improved by a workforce that reflects the population. And our connection to sports is that we do have students in our program who are athletes. I myself come from more of an athlete background. And we're trying to get them into health careers if that's something that they're interested in. And we would like to work more with the NFL and with teams in different sports cities to support opportunity for students from those communities to get into the health field and to address health issues now, particularly with the pandemic and our recovery from the pandemic.
Well, my daughter's a nursing student at University of Pittsburgh, so
all right,
I have one going into the field.
Yay!
And Gregory.
Yeah, I'm Dr. Gregory Charlop, and I love nurses, so your daughter is making an excellent choice. If she has any questions, tell her to chat with me. I travel nursing is an incredible thing. I know a lot of them that, you live in different cities and you go to different places, and it's such a great experience, for a young person to see different places, and it's paid for, which is really great. But I'm the founder of Retired Athlete Health, and I work with active and retired athletes for overall health and sports improvement with nutrition and sleep and that sort of thing. And I'm the founder of the Women's Sports Forum. And what we do is we help women and disabled athletes get the attention they deserve. And we feel that women and disabled athletes deserve better, and that they don't get the support they need from a healthcare standpoint. They don't get the support they need from a media attention standpoint. And there's a lot of great things that a lot of women and disabled athletes are doing, and they simply just aren't getting the recognition. So we're working to try to correct that. And we're actually preparing to launch a big project in the coming months to champion a lot of women and disabled athletes, and also to champion the work that football players and other athletes are doing to help women and disabled athletes. So a lot of exciting things coming along, and I'm really glad to be here with this panel.
Yes, and any chance that you've worked with any female esports athletes?
So a lot of our female athletes are Olympians, and some golfers and tennis players.
Okay, great. The whole field of esports is growing, and that's an area that we may want to discuss at some point. But there's the the FIFA, the Madden game that, and many people feel that esports is unhealthy. So what could we all do to marry esports with activity? Just something that's, I want to keep to traditional sports now, but as we go down, let's think about how we can support those esports athletes and just gamers to be more physically fit as well. So, but talking about youth and fitness, Megan, why don't you share a little bit more details about NFL Play 60 and maybe some historical perspective. How is it doing? How does it work? Your relationships with teams and nonprofits.
Yeah, absolutely. So at the league office, we have national partnerships with nonprofit partners, and specifically an in-school health and wellness program that reaches students in elementary, middle, high school age range called Fuel Up to Play 60. And what's unique about that program is it empowers the student to be a leader in their classroom and at home. And it allows teachers to also have resources, apply for grants, and get their needs met, whether it's in the cafeteria, a cooler, or different food items, meals, to be able to provide to schools that are in need. And it also gives opportunity to have students be physically active for 60 minutes a day, healthy nutrition tips, and also has a student leadership component to that program. So we're going into over 10 years of that program specifically, and you see the generation that has gone to college and now they're coming back and they're mentoring students that are now in the program. So it's not just some one-off type of health and wellness program. It's one that has empowered kids. We've seen it translate to everyday lives, and it's about the one kid. So it's like one kid, there's going to be more than one, and each child is different. But this program really allows to meet the needs. And as it relates to the 32 NFL teams, they implement NFL Play 60, whether it's the Fuel Up to Play 60 program or a relationship with, say, it's their local Special Olympics around unified flag football. They implement it differently. Each team, NFL team, has a community relations department, and they work on the NFL Play 60 initiative specifically. So it's health and wellness panel right now, so I'm just getting into the details of Play 60 and health and wellness, but it's pretty cool because one other note, and then I'll stop, but our NFL players that are now in the league, some of them have been part of Play 60 events since we're going on 15 years when they were in school. And so you're seeing these next generation of NFL players very familiar with the initiative and the program, and they can speak to it naturally. Play 60 is like a natural connection to football. So it's been fun to be a part of. I'm in my 6th season at the league and came from the Tampa Bay Bucks and the Miami Dolphins, and to see an impact on a child, it opens up your eyes, and it opens up their eyes to the potential that they have to lead a healthy lifestyle.
And I'm going to come back to you because the NFL has other health-related initiatives, breast cancer being one of them. And so I'll come back and ask you more about the other health-related initiatives of the NFL community relations.
Sounds good.
Great. So Jeff, if you wouldn't mind sharing a little bit more, do you have any example of athletes that have participated in your program?
Well, let me give you an example maybe of how we contribute to the youth fitness as well. And so what we do is HCC is a national organization. We have hundreds of students each year who participate in our program. And we have programs in 4 regions of California that cover the whole state, as well as in New York, in New England, DC, Nashville, North Carolina, and now in Chicago, Detroit, and those areas. And one thing that we have is that our interns work oftentimes with programs in their communities on promoting health and fitness, particularly for students of color or students from low-income backgrounds in those communities. So in this case, we have college students who are more focused on health, and they're usually people who are majoring in some kind of health-related program, and it could be clinical, like your daughter in nursing, or in our case, we often have a lot of people that are interested in public health and health promotion and being exercise physiology, things like that. So oftentimes they work with like a Boys and Girls Club or a hospital program that's focused on fitness. And so we have students from the community who speak the language, who look like the folks in that community, who are working to engage young people in those communities in these kinds of activities. And so we found that's very effective at helping the individuals with more fitness and health, but also then helping that student who's in our program to be more likely to get that experience that's really helpful for them to be leaders, as Megan mentioned also, to be role models as somebody who's in college or who's graduated from college for students, and be mentors and those kinds of things, both formally and informally. Then it helps those students to get a job and then continue to pursue in their health career field. So I think that's a strength that we really bring. And we're trying to do that on a larger scale, and perhaps could partner with some of your organizations, that are doing that work. And then in terms of athletes, I mean, we have right now we have a student who was the captain of the women's soccer team at Clark University, just one who just popped into mind, who's part of our program and has been doing. In her case, she has that background, but she's now transitioning she's finished being a college athlete, and now she's transitioning to pursue medicine as her career path, combined with public health and combined with making a difference in social and racial justice. And so the program that she's in with us is helping sort of empower her to make good informed choices and to go on to get that education and to be supported to get that, but also to learn how to continue to be a leader, which she was on her campus, at advancing racial justice and health for students on campuses to do that kind of work. And so we have other students who are in those kinds of roles in our program.
Excellent. And then Greg?
Well, I'd just like to say before I say anything, Megan and Jeff, the stuff you're doing is awesome. I love it. And Megan, I was thinking while you were talking about how important what you're doing really is, because I work with obesity a lot. I mean, frankly, that's one of the things I see very often in my practice, and the numbers keep growing. And we know there's really pretty good evidence that childhood obesity leads to adult obesity, and childhood inactivity leads to adult inactivity and all kinds of medical problems. So the early interventions that you all are doing with the NFL, I really think is making a big difference for kids, but it's also making a huge difference for them as they grow up into adults. So I really applaud the work that you're doing.
Thank you.
Yeah, that's awesome. I really, if there's any way I could support that, I love it. So I'm happy to learn about it. The stuff that we've been mostly focused on in terms of youth activities, I think is what you were kind of asking, is, I'll tell you, we talked about this actually the other day in the disabled athlete forum. There's a lot of disabled athletes, and there are kids that they're just really remarkable. I mean, I hear the stories of these kids who often are missing one or more limbs. In fact, the person I was on the panel with yesterday, they had as an infant, they were missing 4 limbs. He didn't have any limbs. He was adopted from Croatia, and he ended up becoming a Paralympic athlete, which is really unbelievable. And it's just such a testimony to his dedication and his conviction, but also it speaks a lot to support systems, which is one of the things that we really try to focus on. And I'll give you an example. If you or I wanted to go play basketball, we would just grab a basketball and we'd walk out the door of our house, and we'd walk a block or two and we'd find a basketball court and we'd go play. But if you're a disabled athlete, it's not that simple. You, first of all, might need some devices, some adaptive devices, which are not cheap, and they have to be customized and they're hard to get. And once you have that, you probably need special physical therapy or people to help you use them and to train to use these devices. And then if you want to go play, you still couldn't go to the corner. You would probably want to play with other disabled athletes, other people that were experienced with using the types of devices and stuff you need. And so you may have to travel an hour, 2 hours, 3 hours just to play a game of basketball. So there's all these challenges that disabled athletes face that the rest of us really never give any thought to, and it's important. And so we're trying to shine a spotlight on this. And for women, one of the big things that we've noticed is in addition to the whole travesty with the NCAA, and we all were shocked by the weight room scandal to the NCAA and how poorly the women athletes were treated. But even more subtle things that we don't talk about but should be. For example, women's healthcare needs are different than men's, and their nutritional needs are different, and we need to pay attention to that. There's concern with timing of families and pregnancies and periods that we need to be giving thought to, and simply we often aren't. And so this is the type of work that we're trying to do with the Women's Sports Forum to bring more attention to these issues.
I mean, all of that, there is actually a lot more research now being done in terms of, menstrual period times and, peak performance, and how do you work around that? And so,
it's funny, one of the people I was working with on the forum, she actually said, she sort of blew me away. She said, your period is your superpower. She said, as long as you know how to time it and you're clever about it, you actually have more energy and you have more stamina and everything else. And so, women actually have this hidden strength, and they need to use it, and we need to recognize it as such.
right. And do you know of any nonprofits or any programming that's going around, discussing this women's only programming or anything like that?
There's a great one, and we actually partnered with a number of charities, and two that I really like are the Black Women in Sport Foundation, and Her Next Play. The Black Women in Sport Foundation helps women of all ages, kids also, and adults. And Her Next Play largely focuses on helping women athletes sort of after their athletic career and to figure out what next steps are. But there's actually, I wish there were more organizations, but there are some good ones like those two. And another one that I really like is Athlete's Soul. Athlete's Soul is actually created by a female multiple Olympian. She and I are good friends, and they do great work for women and male athletes, both of them, but it's headed by a woman, and they really do incredible work. So I recommend Athlete's Soul, Her Next Play, Black Women in Sport. And The Hidden Opponent is another one that I'm a big fan of, The Hidden Opponent.
The Hidden Opponent.
Mm-hmm.
Okay, great. And, I'm going to go back to you, Jeff, real quick, because, I was just thinking, how do we get more medical doctors? I guess both Gregory, you can touch on this too, prescribe physical activity versus medicine. I mean, it's a huge issue. Just my background, actually, I conducted the last federally funded fitness study. So in 1986, we did a national fitness study for youth 6 to 9 years old. And at that time, children were obese, and we knew it was just going to get worse. And, it's just easy to prescribe, or, just give me a pill and I'll be better. Exercise is hard work. It makes you sweat. So how can we get more people to exercise versus take a pill?
Well, I'll start, and Greg and Megan. Megan, sounds like you have a lot of experience with that as well, and what you're doing. I come from being a health executive and also a faculty member in health policy and management at UC Berkeley. And in my experience, what gets paid and what gets measured are things that really will then influence the behavior of health providers and health organizations. And I think that it's very difficult right now for clinicians who are often trying to just deal with as many patients in a short period of time, and they often sometimes have enough time to prescribe something and don't have enough time to do all the other aspects that might help somebody with their health, including even understanding, does somebody have a healthy place to go exercise, and a safe and healthy place to go exercise, which is an issue. So I think some positive things are that the way the direction of health is going is there's a focus more on paying to keep people healthy. There's something called value-based payment, which is going to incent health organizations to help people be healthy. And so now, instead of just the individual physician having to prescribe exercise or deal with getting people motivated. There now will be more teams of people with a financial incentive to do it, where it might be the physician in addition to a nurse practitioner or a PA or a medical assistant, a health coach. There's more health coaches now and wellness coaches. And there are more companies that are, if someone's identified to be at risk for obesity or diabetes or cardiovascular disease, there's more likelihood that they might be assigned a coach, and maybe somebody from their own culture who speaks their own language. Again, maybe some of our Health Career Connection students, to help them be more likely to get support to do that kind of work. And so I think we're going to see more things now, instead of just paying doctors to see one patient at a time. It's like, let's keep people healthy on a population level, and let's measure the health, and let's reward people based on the health status indicators of individuals and populations. We're going to see more exercise prescribed, more going out in nature prescribed. And then particularly, there are all programs now that are being developed using digital health to connect people to resources. So if the doctor says, or if a health coach says, here's the exercise, then, well, here's where you can go exercise. And by the way, did you know that there's an NFL, Play 60 program in your community, that you can get connected to? Or here's this after school, there's something called Playworks, or there, I think there's going to be more of a focus now on connecting people and then making sure that they go, and following up with them to see how well they did, and getting them into organized systems of care. That's not just healthcare, but that's keeping them healthy. So I think that's the direction the health field is going, and I'm encouraged by that.
And who's backing this right now? Who's pushing this?
Well, it's coming from a few sources. One is health employers. Employers that are paying the bills. They are seeing the cost of healthcare go up, and the outcomes not go up correspondingly. And they're also seeing, just as was alluded to, that young people are, we need to get them early on to help support them to be healthy and be in healthier conditions. So I think some of it's coming from the health plans themselves to the health systems and the hospitals and the physician groups and those things. Some is coming from government, like particularly like Medicaid programs around the country. There's something called Medicaid managed care that more and more people are going into. And the government's like, hey, we want to keep people healthy. We want to pay less money. So some of it's coming from the state or federal government. And some of it's just coming from the movement to improve health equity and reduce health inequities in our country, and building conditions for people to be healthier, within their communities, and empowering them to do that. So there's pressures from those different perspectives from my experience, but I'd be curious what Greg and Megan might say also.
Yeah, thank you. Do either of you want to jump in and share, like, how does Play 60 reach those communities that may not have access or, safe spaces to play?
Yeah, and that's the beautiful thing about the 32 NFL teams is each one of their markets, particularly NFL markets that a team is in, they know and can identify those schools of need and help provide safe play spaces. So Carolina Panthers comes to top of my mind as a team that does incredible work in their community, and they create these play spaces in areas maybe that just need a place to play, and it serves the community. I don't have the exact number, but it's in the thousands. It's in like the tens of thousands of community members that come, and they will go to this park or this play space to be able to play a team sport or play an individual sport. And to add to that, PE teachers across the country being able, through the Play 60 program and the initiative, to equip the teachers to have a resource to provide to their students. And another beautiful thing about the Fuel Up to Play 60 program is you could be a math teacher, you could be a science teacher, you could be a history teacher, and still be a Fuel Up to Play 60 teacher ambassador. Maybe even help out the PE teacher that's at that school. Just get those kids moving. Could be in the classroom. Where's the amount of time and space that a kid is at? If they're not at home, they're either after school programming or they're in the school. And so just being able to provide a place to play. And we have NFL Foundation grants, and we work with the 32 teams on that to provide the backing, that the community would need to build that space or refurbish a space.
Good. And anyone can apply for those grants?
No, with the foundation grants, it's specific to a team. So each team will have a NFL Play 60 program grant, and they can customize it how they like to fit whatever their model is. It could be building a playground. It could be providing equipment to multiple schools that they work with on a consistent basis. There's so many things that clubs do. It could be providing flag football kits to a teacher and they create a team sport. And maybe that's the introduction that child needs to say, hey, I can play sports, or maybe I don't like sports, but I like this digital programming that my teacher's playing in the classroom, and I like doing a jumping jack alongside my friends. And I didn't realize how much fun it could be. So I'll stop there. I could keep going, but
It's all good. It's,
PE teachers are important.
I mean, it takes a village, right? And, each one of your programs and your efforts are contributing to, helping stop the lack of physical activity or getting more people involved.
Yeah, and real quick, I just want to add, Fuel Up to Play 60 program is elementary, middle, high school students. We also have a nonprofit partnership on a national level with Special Olympics, and Special Olympics provides athletes with intellectual disabilities to play on the same team as athletes without intellectual disabilities around flag football. So really helping communities. And what's unique about Special Olympics is their age range could go older, it could go younger. But being able to still provide that play opportunity for those groups of people.
Yes. Greg, did you want to add something?
Yeah, I would love to actually. This is a great topic, and Megan, it was exciting to hear you say all the different opportunities that the NFL has taken to partner with schools and different philanthropic groups. And Jeff, I have to tell you, that was one of the best sort of summaries of health policy in 3 minutes I think I've ever heard. That was really very impressive because it's a very complicated topic, and you presented it in such a clear, easy to understand, and honestly sort of optimistic way. I wish I recorded that. I would have loved to have listened to it again because it was really well said, and it's a very complicated topic. But I'll tell you, I have twin daughters, and I took them to get a regular checkup a couple months back, and they had 10 minutes or so with the pediatrician, and so they asked how much milk they were drinking and whether there's guns in the house and if we have a swimming pool in the backyard and if they exercise, and they did all these things, and then she listened and asked if we had any questions, and that was the end of the visit. And I think that most of us have probably had similar experiences with our pediatricians. And I'm not knocking her, she was great, but unfortunately doctors have a limited amount of time, and there's certain things that they're mandated to cover. They have to check if you've done your vaccines and pool safety and everything else. And some of this changes depending on the age of the child, but there's basically a laundry list of things that the doctors need to check on. And they have to kind of go through it and they move on. And that's really, unfortunately, that's often all they have time for these well-child checks. So I agree with Jeff. I think that the solution on the medical side, I think Megan has some great solutions on the sort of philanthropic corporate side, but on the medical side, I think the solution's got to come from systems. The doctors simply won't be able to, either because they're not interested or they're not paid for it or they don't have time. The doctor's not going to be able to take the lead on this. And I say this as a doctor, and I know it won't. The doctor conceivably could refer someone to someone else within the organization who does have time and focuses on this, or to different programs set up through the organization. And I think that's the solution. I worked for many years with Kaiser out in the West Coast, and that's what happened. For example, if someone had sleep apnea, the doctor would refer someone to the sleep apnea specialist, and they would work with them on the CPAP machine and all different types of things to help improve their sleep. And those programs have great results. I mean, they really work well. And I think the same type of thing has to happen within the medical system for exercise.
Right. Yeah. And there's kids that by the age of 5, they're already obese. So if you don't stop it then, when are you gonna, when are you gonna have that chance to stop it? So, but now going back to you, Megan, about what other health initiatives is the NFL involved with?
So we have a Crucial Catch initiative. It was called Breast Cancer Awareness, started out as Breast Cancer Awareness specifically, now called Crucial Catch. And it's all about promoting and encouraging early detection and risk reduction. So it started out as breast cancer, specifically NFL players, and each person, like NFL fan and people, can identify with either a family member that has had breast cancer or they themselves have had breast cancer. And then it spanned to these other screenable types of cancer, colorectal, colon, lung cancer. So you'll see it really take place, Crucial Catch, on field at specific times of the regular football season. And you'll see the different colors, which identifies the different cancers that are screenable. And so each of the 32 NFL teams will work with their local American Cancer Society. So we have a national partnership with the American Cancer Society to implement different grants, equity grants that will help underserved people in their communities, usually the NFL markets, to be able to get screened in a healthy way. So that's one of our other health initiatives. Yeah, I'll pause there. But Crucial Catch, and it started out back in 2009. So we're going, it's 2021 now, still going strong and still more work to be done. But that's an initiative that's heartfelt because a lot of players, NFL players, have moms, and dads can actually even get that too when it comes to, like, say, breast cancer or anything like that. So it's one that it's near and dear to the heart, and it can hit home for a lot of people.
Exactly. And, there's so many positives of sport, but there's also some negatives. I mean, we've seen the whole concussion issue. We've seen the depression issue that some of these elite athletes are facing. Would either of you like to discuss some of the negative consequences of sport?
I'd love to, actually, that's a great topic. I'd love to jump in a bit. With Naomi Osaka, that really kind of helped shine the light on depression and mental health issues for athletes. And I think we all need to kind of tip our hats to her because she sort of suffered through this in a very public way, but with a lot of grace. And I think that she helped bring a lot of attention to these problems. And the truth is, and I've spoken to a lot of athletes about this, is there just isn't, in many cases, a great support system for athletes. A lot of athletes who have depression and anxiety, which is common actually for athletes, many of them, they don't feel like they have someone to talk to, or they're afraid to talk about it. They think that it makes them look weak. And so a lot of athletes tend to suffer from mental health issues sort of in silence or on their own. And they don't typically get the help that they need. And I do believe that groups like the NFL and the NFLPA, they care about this, but it's sort of a cultural thing where I just think many times either people are afraid to speak up, or they don't know they can, or the resources aren't clear sometimes to people. So I'm happy we're talking about this, and it's a big problem. And truthfully, I think the pandemic made it worse. I spoke to a lot of athletes. Athletes are used to being around their team, and they're used to playing, and they're used to being part of groups and being with their coaches and their fans. And, that was taken away from them during the pandemic. And a lot of athletes really suffer from that.
Yes. Jeff, did you want to add anything before we discuss?
I don't work with athletes specifically around mental health issues. Although we do, again, the athletes that are in our program, we actually have training just today. We had a training for all of our interns around mental health issues and mental health awareness and stigma reduction. And particularly since our students are primarily students of color, there's a lot of talk about how in their families that there's stigma, they're not allowed to talk about it, they're not allowed to really deal with it, and those kind of things. So I don't know specifically about about athletes and mental health support, other than just in general as a health professional. There is no health without mental health, right? And so that we really need to be able to provide more of that kind of support for athletes. And I do think you have more people that are disclosing, like Naomi Osaka, and you have people like LeBron James supporting Calm and some of those kinds of things. So I think the more we can do that, the more it will not only help them, but given the role that athletes play in our society, the more that them saying that they're addressing these issues will really help so many other people, particularly young kids that are athletes that are coming up behind them. So I guess I would encourage us to provide obviously more support for athletes at all levels to do that, but then encouraging them to talk about it so that other people it can be normalized and other people can get into systems of care. I do have one other just thing I would mention about ways to support athletes, though, would be to provide opportunities, beyond their athletic careers. And it sounds like that's something that that Gregory does in a really important way. But I, from personal experience, have worked with folks that are high school athletes, college athletes, that then their whole life was going into that. And then when they all of a sudden, when their career came to an end, maybe not on the time frame that they wanted, well, then what is the opportunity for them, and dealing with the psychological impact of that, but also preparing ahead of time for them to have opportunity that they can go into. So that's why, again, for Health Career Connection, we're saying, how can we support athletes to have internships maybe in health while they're students around their athletic work, so that they can go into something afterwards, should they choose to not have their career be able to continue. And I know the NFL has really good internship programs for NFL players going forward. So just in terms of supporting people, hopefully we can do more of those kinds of things for folks, and maybe utilizing their roles to promote physical activity and mental health and social justice, because they're the best kind of role models that we could have for people to do that.
Right. And, Gregory, you do the retired athlete health. And if you saw that documentary, The Weight of Gold, it did focus on, wow, I'm an Olympic athlete, and then boom, I'm done and nobody's there. I had this great support system, and then I'm thrown on the street, basically. I do think that mental edge, I know a lot of Olympic athletes, and they all have a special way about them, because you have to be special mentally in order to put that much training and focus into your life. And so it's not surprising that they have some mental challenges afterwards.
Unfortunately, it's, and I hate to say it, but we all know it's true. It's a very small fraction of athletes voluntarily retire, if you want to put it that way. Most athletes end their careers involuntarily, either like you said, they're Olympians and now they just can't make the cut, or maybe they're Olympians, but now their age makes it difficult, or they're pro basketball or baseball players and they get cut, or they have an injury. And those are the most common reasons why athletes end their careers. And this is difficult for a lot of people, because the truth is, in my experience, if you want to be a successful athlete, you really have to believe in yourself. And you really have to believe from a young age that you can do anything. And if you put in the effort and you go to the gym and you go to tryouts and you leave everything on the field, that you're going to make it. And if you don't feel that way, you're never going to get far. So all the professional athletes we see, like they believe in themselves, and they have to. So when you have that type of personality, and then when it's involuntarily taken away, when your sport that you've been training since you were a little kid is now ripped from you, that has a big psychological toll on a lot of people, because a lot of people define themselves by the sport, and they define themselves by the fans and the travel and all the things that go along with the sport. And so it becomes very difficult for many athletes after involuntary retirement. And I think a lot of them do need that support. And, I kind of joke about this, but, there aren't that many football players, let's say, that go into football and they think, hey, if it doesn't work out, I'll be an accountant. You just don't hear that much, because they all think it's going to work out, and they should. but then they get thrown into this situation that they weren't expecting, and it's tough. It's a tough situation.
And I know the NFL has a transition program along with the NFL Players Association, but it's outside of community relations. I'm just not sure, Megan, if you can address any of it.
Yeah, we have a development program. A lot of these players come out of the league and they will come to the league office. They come to New York City. They come to our LA office, depending on, what would work best. And a lot of the players are in the football operations department. So they're still connected to the game, just from a business side of perspective. So it really allows the players to get an inside look into this league that they've played in, and it's from a business perspective. So it's a different change for a lot of the guys playing the game and then coming to the business side of things, but they bring amazing ideas. They help the league in such a unique and beautiful way that in the mind of an athlete and how they see the game, and they're competitive, and they have natural leadership abilities that each person can carry, and it just translates differently in a workplace setting, but they got it. Like, it's not like they're coming in at like novice level. They're coming in with their own knowledge, and could only help this development program be better off for the other players that are going to come through it too down the road. So yeah, it's a plus.
So I have another question for you all. If you could create and fund a program, it could be either an existing program or a new program related to health and safety in athletics or in sport, what would it be? Where do you see a big need that may not be filled or that you could expand on?
I was like, I can't speak for the league on this, but because
No, that's
budget. But sorry, go ahead,
we're
Greg.
pretending that you have money from
Yeah.
something.
Greg, you spoke first, so.
Oh, sorry. No, I don't know. I don't know if this is exactly answering the question, but I would try to bring more attention to women's issues. And I just want to give some examples. You just don't think about these so much because they don't come up, but they're important. Women's nutritional needs are different than men. And I heard a good quote the other day: women are not just little men, they're different. And so I think we need to give more attention to what are their caloric needs and protein needs for women athletes. How does that change with age? How does that change if they're pregnant or breastfeeding? These are issues that I think the sports world has largely avoided. What happens when women are missing their periods over long periods of time because of intense training or their diet? What are the long-term consequences of that? Are we hurting these women? What are the consequences of forcing women to delay pregnancy because they fear that if they get pregnant, they'll either get kicked off their teams or they'll lose their sponsorships, which has sort of been in the news lately. What are the consequences of these things, and how could we help these women? So I think if there's anything I could fund, it would be something to take a closer look at those issues.
And do you believe, going back to you, Jeff, about training of medical personnel, do you think these strength and conditioning coaches, the people who are working with the athletes, are getting enough education in that area?
That's something unfortunately I'm not really experienced and qualified to comment on that particular, whether those coaches are getting enough experience. And having some of my students that are pursuing those areas, I know that there's a lot of people motivated to do that. And I think there's increasing numbers of that. And with athletic training, but I don't know, I can't comment, maybe others can comment on the training, the level of training that people are getting.
Gregory, do you feel that the medical staff that's working with the women you deal with are educated enough in this area?
No, I could categorically say no. you know, a lot of times, I mean, it depends on the organization, right? But for colleges, a lot of times there's a limited medical staff that sort of covers everybody. And most of their attention, frankly, is focused on you know, certain sports, and they don't have much expertise in women, and they're not asked to give much attention to women athletes. And women's sports are underfunded. I mean, that's just the fact. And so they have less money to spend on athletic trainers and doctors and that type of thing. I mean, I think if a woman tears her ACL, she's fine, you know, because an orthopedic surgeon is amply qualified to fix a woman's ACL or a man's ACL. But if a woman is trying to sort of juggle breastfeeding and her sport, I think that she's hung out to dry, truthfully. I think that she doesn't have the support that she needs in most organizations. And I don't think a lot of people are trained to do this.
Great points. And anything, so going back to you, Jeff, now about what would you fund?
Yeah.
Great.
Well, I'm more of a, you know, I'm a public health person who looks at things more on a community level and systems and policy change level. Given the pandemic that we're hopefully coming out of now, and the devastating impact and disproportionate impact that's had on many of the communities and of color and low-income communities, and those that are in the areas where the NFL and NBA, you know, NBA stadiums, Major League Baseball stadiums are located. You know, what I would, if I had the funds, I would encourage the leagues to come together to say, how can we support opportunity for people from the communities that are in our areas, you know, where our fan base is from. How can we support them to help with their recovery by giving them more economic opportunity, which we know is tied to health, education opportunity. And then I would support, I'm a little biased, but I would support these folks going into health, getting people into health careers, and as a way to help them work on COVID and then other health issues, health equity issues, racial justice issues in their communities. And the team shining a light on that would be really powerful to do that, and to show, look, we're getting people from our community to work on health issues and economic development issues in our community. And then as we're also giving them wages to do that so that they can earn income along the way, and then allowing them to have some upward career opportunity and hope that they can be successful. And I think that's a win on a large scale. That would really be a big part of our recovery. That would help individuals with career opportunities and education, and which we know are linked to health. And it would also help improve the COVID response and recovery and addressing health equity within our communities. And I know that I actually know a colleague who's working on putting something like that together. And so that's what I would invest in.
Right. And, you know, I know, like Los Angeles, all the different teams came together. There was, you know, the Dodgers and the Lakers and LA Football Club. Megan, are you aware of any joint initiatives that teams have done with other teams?
Yeah, one doesn't come to my mind specifically, but I do know that teams have worked, actually Cleveland Browns specifically, when we were at the draft in Cleveland in April, they were working with their local NBA team and a couple other groups. I don't know the specific details, but I know that they were in conversation, each community relations department, to work with their communities on specific needs. So it's definitely a thing that is real and it happens. So that's one example that I just learned of in April of this year.
You know, one thing that I find working with various nonprofits is they tend to all of a sudden serve the same community. And I don't know why that is, whether it's difficult. How do you reach the need, the community that needs the support the most? But I find, like here in even Washington, DC, it's certain schools are more always the ones that get support. where some don't. And is it that principal? Is it that people don't reach out to other schools? They've just heard this one is willing to work with us, so we go to that. I really think something needs to be done. And I've had a friend work on mapping projects where they, look at all the resources and look who's getting them. And it's frustrating to me to see even some, I don't know, some nonprofits even just keep getting the same grants when there's other nonprofits that don't. I'm just throwing this out for a discussion. I don't have any answers.
Well, it's a great question. And so there's actually work in the health field where health systems now, nonprofit health systems, have to do community needs assessments. And they have to do it in conjunction, actually, and many of them are doing it with other health systems within their regions. And so I don't remember how often they have to do it, but I think it may be every 3 years, every 1 to 3 years. So to your point, there could be some assessment that you could utilize assessments that are being done about what are the health needs in communities and the priorities of those communities, not just what a nonprofit or a health system might want to do. It's based on what the priorities are, and it's mapping the resources as you're talking about already. And it also overlays like education and housing and income and those things. And so you could use things like that to then make better informed choices about where to have the most impact, on health in a community, rather than just, here's our go-to school or here's our go-to, nonprofit, something like that. I think there's gonna be more of that work.
Mammogram always goes to this one community.
Right.
What about the other corners around the block?
Right. Yeah. And some guidance on making sure that we're serving the most vulnerable rather than just in some cases, they go to the places where they have it serves, it historically maybe has served that system because that's a market that they want to be in or something like that, versus here's where the real need is. So yeah, you're right. It's a really good, big need that you pointed out.
And Lisa, that's a good answer, Jeff. And Lisa, going back to your specific question about grant funding, if you could have more grant funding to create anything. We have some faithful listeners here, Caitlin and Ethan, who are still on with us, but and Kelsey just joined. But I would go back to kids and some of the work that we're still doing with youth health and wellness, because when we're gone and we're not in this earth anymore, we have a whole next generation of youth that are coming behind us, and will be the ones talking about these types of challenges or issues in their communities. And each athlete that was mentioned, whether it was mental health or any athlete that was mentioned on this specific panel, every one of us were kids at one point in time. And so when it comes to youth sports, that one fires me up, because if we could even go across every state in America, but it ranges internationally. We have the Olympics. What is it centered around? What does it bring all these countries and these people together through sports and things that we've created as people to like come together and play. And so if you could provide play spaces, playgrounds, tag, like I remember growing up playing tag, and like that takes to your body, it's like you show up, right? And so there's things that don't even need equipment necessarily, but a safe place to play with another fellow kid. And even that, talk about science, that helps your mental health, that helps your physical health, that helps all the different things that fuel our body and keep us sane. And so it's just that's important. And growing up as a kid, loving sports and being outside and wherever it was, you have city kids, what does their play space look like? And so just really recognizing our neighbor and figuring out what's going to be helpful for the community. So I would just keep investing in that, kids.
And, I'm hoping Tom Ferry is going to be successful in getting a percent of the gambling, the betting money in New York to go to youth sports. I been promoting that for a long time before gambling ever became official. But I really think we need to get more kids access to playing, not even competing, just going out and playing. And so with that, I want to support, Megan's focus on the youth. And do either of you have a closing statement that you would like to say regarding health and safety in sports?
I'll start. I'll say that I've noticed over the years that there's been a renewed emphasis on this. I think that more people are talking about mental health, as you mentioned. We're talking more about kids, and we're talking more about disadvantaged communities and social justice issues. Concussions, we're certainly talking more about than ever. So I think that we're heading in the right direction. I kind of share what sounded like Jeff's optimism and Megan's optimism. I think things are heading in the right direction. Just the fact that we have conferences like this conference, it makes me feel good, because there's a lot of people working on the problem, and there's a lot of people who want to work on this problem. So I guess my closing statement would be like, I kind of feel good about, obviously we have a long way to go, but I feel like we've got a good team, and we're working towards good ends. And I'm happy about that.
That's good.
I would just say this is a
Keep up the
moment of,
good work.
yeah, well, I just build on what Gregory said, and I just think this is an incredible moment of opportunity created coming out of a horrible crisis. But it's a moment of opportunity to really accelerate efforts and investment and action. So I'm hoping that we can do that, particularly for folks that are the most vulnerable, and then engaging athletes in that in a way that will benefit them in the near term and over the longer term, and using the platform that athletes and teams have and leagues have right now to make those changes. I'm hoping we can do that.
Great. And any last comments or thoughts, Megan?
Yeah, when it comes to health and fitness, specifically youth health and wellness, which is what our 32 NFL teams really focus in on, and even players' foundations that center around health and wellness, just want to shout out them, because they're making it happen in their communities. And you have players that are playing in Houston, Texas for the Texans, but they're from Baltimore, Maryland, and they're giving back in both communities. So just really want to shout out each person that is doing work when it comes to health and wellness, specifically, and PE teachers and parents, and the future kids that are going to be the advocates for this too. And so it's exciting to see. Still a lot of work to be done, and for us to learn and continue to grow, but you got to start somewhere. So taking a step in one direction, that's forward.
Right. Well, all of you are, leading the way, and loved all the initiatives and thoughts that you shared with us today. Look forward to staying in touch and seeing how we can continue the barometer moving forward in athlete health and safety. And thank you all for joining with us today.